Hello, podcast listeners. You are now listening to the Coffee, Health, and Science podcast. I'm your host, Jordan River, and I want to thank you for tuning in again today. Before we get started, as always, I gotta urge you to share the show. Tell a friend about the Coffee, Health, and Science podcast. Spread the show. It's how we grow. And hit subscribe so you catch every single episode right when it drops. Like today's episode, back with Dr. Coffee. What's up, Dr. Coffee?
Hey, it's another day above ground living the dream, my friend.
You're dang right it is. I got my Purity coffee right here. I'm ready to jump into today's episode. I love these explorations on health. I mean, we do a lot of different styles of episodes here, from history to news and everything in between. But these health deep dives are seriously some of the most eye-opening and enlightening and useful for the audience. So we're talking headaches today. Do I got that right?
You have that right. Today we're going to do the end-all and be-all for pain in the head.
Oh, man. This is a topic near and dear to me. I've suffered from migraines and clusters. I know I have listeners who also suffer, so I'm excited to dive right into this. Where would you like to begin on this, what I know to be very complex topic?
I'll tell you what. I'll just go off on my own tangent and pay no attention. So today we're going to discuss headaches. And I remember in school, one of my neurology professors said to me that he thought the number one cause of headaches in the U.S. was coffee.
Oh, boy.
And that really got me thinking. Now, as you know, I've had an interest in trying to learn everything I can about head pain for the last 40 years. Mm-hmm. I've even written a beautiful monograph on migraine headache that if any of your listeners would ever like, they can email me. And I got a new email address for everybody, doc@myhealthypatient.com.
Oh, that's wonderful. There you go.
doc@myhealthypatient.com. You email me, put in the subject headache, and I will send you off a great migraine headache monograph I wrote. But we have basically 4 types of headaches. There are more than that, but that is not applicable for our discussion here. What we're going to discuss here are 4 main types of headaches. Mm-hmm. And migraine is 1, cluster is 2, tension is 3, and cervicogenic, which can lead to tension, is 4.
Okay.
And I'm going to go into details what they are and what the relationship to coffee is. So this is not just a course in headaches. This is also a relationship between my favorite drink in the world, coffee, and head pain.
Oh my God.
How's that,
I
Jordan?
am all in, as they say. This sounds perfect. Are we going to go down in order? Do we start with migraines?
We are going to start with a migraine. So a migraine is a severe headache that when I first started studying, the cause was vasodilation. So vaso means blood vessel, and dilation means expanding. Mm-hmm. So the dilating of the vessels in the brain. And what was thought was that you get these blood vessels that then dilate in patients, more blood supply goes into the brain, and then it clamps down, and you've got this problem in which you have almost like a space-occupying lesion. You don't have room in the brain for this increase of pressure, but it's there, and this leads to head pain.
Right.
There is a new theory that's been out for a couple of years now, especially since there's new treatments drug treatments for migraine that look at the electrical firing of the nervous system leading to waves across the brain spectrum, which lead to the head pain.
Wow.
It also leads to an imbalance in neurotransmitters at the time, like serotonin. And so this is what they're now thinking is the cause of head pain. Both of them are fine with me because one of the treatments that we use is IV magnesium, and magnesium is used both for whether it's for the blood vessel constriction and dilation or whether it's this electrical flow. So it hasn't changed my thinking of how to treat migraine. So
Well,
anyway,
probably related.
Let's go back to migraine. Some people experience it only as pain. Other people experience it as either aura, where they see a visualization of thing,
Right.
or they get a sensory symptom, a neurological symptom where they're not seeing it, but they're getting this fuzzy feeling.
Right.
And there is a great deal of difficulty in being able to tell whether a person is having a migraine or is having a tension headache. And the reason is because they both can present as the same thing.
Mm-hmm.
And so I always almost laugh when somebody says, oh, it can't be a tension headache because I feel nauseous, or my doctor said it can't be a tension headache because I get this sensory feeling. Well, that's just not true. It can be a tension headache, and we'll go into that when we get to tension headaches. But the most common symptoms with migraines are nausea, vomiting, and sensitivity to light and sound.
Right.
So typical for a migraine patient, they'll go into a dark room, they'll lay down. There is an association between light and triggering a migraine, or light and continuing a migraine. And there actually is a new product that is a godsend for some people. And if anybody wants the information, I don't have it at my fingertips right now, but it's eyeglasses that have a very specific green filter in them.
Oh, the Spectrum. I've seen these. I think they sell glasses. Don't they also sell lights?
They do sell lights. They do sell lights, and they also sell glasses. And what we've been recommending for headache patients is they drop the couple $100, get the glasses, and the first sign of a headache, they put the glasses on and they filter the light properly.
Yeah, you got to get us you got to get us the name brand, because I'm seeing a few different name brands here. I'm just reading these off of the internet. We're not necessarily endorsing these. TheraSpecs is one, Avulux is another one.
That's it.
Avulux, those are the green ones?
Yeah. So those are the green ones. I know that the medical doctor, the ophthalmologist who invented them, is just one of the sweetest men in the world. You actually should probably get him on for a podcast once, and I can try and set that up. But he really is just brilliant, has come up with this wonderful non-invasive solution for migraines that works in a lot of the population, not everybody, but a lot of the population. Anyway, moving on, a migraine is just not headache pain. It's also can be considered a neurological disease, and it affects over 1 billion people worldwide.
Wow.
You're supposed to gasp. There you go. You were delayed in your gasp for when I said 1 billion people.
I'm at Avulux.com, but I caught that. Yeah, 1 billion people. That's wildly large impact.
Yeah, it's actually considered to be either the third or fourth most prevalent disease, period.
Whoa.
Yeah, so I mean, it's up there. And the amount of money lost from people losing the ability to work because of migraine headache is phenomenal. We could power, a state with the money lost per year.
Jeez. Yeah, I didn't think about that. I've certainly experienced that as a migraine sufferer.
Yeah, so that's migraines. Now there are things that can trigger a migraine, and we will hold coffee out till I get through the other types of headaches. A typical migraine consists of 4 phases. Not everybody experiences all 4 phases, but the 4 phases are: you get what's called the prodrome, which is usually a feeling that you're going to get a migraine.
Right.
It's what we call the premonitory phase, where you get a premonition. The S is going to hit the fan. Then the aura, then the headache, and then the resolution of the headache, which is called the postdrome. So those are the 4 phases. Most people with migraine have them. Not everybody. A lot of people don't have aura. There are triggers for migraines. Certain foods will trigger migraines. Changes in sleep trigger migraines. Certain food allergies, exposure to light, and in women especially, hormonal changes. So we see changes in migraine around puberty, menopause, and PMS. Anxiety, stress, and the opposite, relaxation, can all trigger migraines. With migraines, slow and steady and reproducible wins the field. So if you're getting up every morning at the same hour, going to bed at the same time, if you're living that cycle, that life cycle that's very similar, you decrease your chances of triggering migraines considerably. Avoidance of triggers can't completely prevent migraines. So people that have migraines are still going to, I liken it to having a computer that's got some kind of inborn error in it. And whenever you hit a combination on the keyboard that it goes dead, that's a migraine. So we have these different triggers, and all of a sudden we can hit this combination and boom, you get a migraine attack. When the migraine occurs, there are medications that can be used. If you are a migraine sufferer and have not seen a headache specialist, you owe it to yourself to see a headache specialist, because there are preventive medications, either medications like triptans that you can take at the time of an attack, or there are preventive medications now that can be taken regularly. There are some natural supplements also for migraine that can be taken. And remember, we're going to come back to coffee. The second type of headache is what we call a tension headache. And they're the most common type of primary headaches. About 90% of adults have had or will have a tension headache at least once in their life. They're more common among women than men, probably due to hormonal changes. And they usually begin at the back of the head or the upper neck. And they feel like a band, where you get a band-like tightness or pressure around the head. They may be described as a band of pressure surrounding the head, with the most intense of the pain over the eyebrows. The pain associated with tension headaches is usually mild, not disabling, and it can be bilateral, meaning both sides of the head. But you can have severe tension headaches. So that's why I said before, you don't know for sure that tension headaches are not, and migraines, which one it is, just by doing symptoms. However, tension headaches are usually not associated with nausea, vomiting, or sensitivity to light, though in some people they can be. And in some people, migraines aren't necessarily worsened by them. But there is a differential in most people where we can separate out and say, you've got a tension, you've got a migraine. The end result is we're going to treat a person for headache management, no matter what. The third type of headache is a cluster headache. Cluster headaches are very, very interesting. If any of your listeners have cluster headaches, please jot me an email to doc@myhealthypatient.com and say, I'm a cluster sufferer. I would like to talk to you. Cluster headaches are a very unique entity. They come in groups of clusters. It would be very typical for a person to say, I've been fine. It's been 9 months. I haven't had a headache. And then one day I went to use my mouthwash, which has alcohol in it, and boom, I got a pain over my right or left eye. It's usually one-sided. It felt like somebody stabbing me with a hot poker through my side. It started at a pain intensity of 20 on a scale of 1 to 10. It lasted for exactly 90 minutes, and then it was gone. What was left was this feeling of tenderness in my scalp. Mm-hmm. It had felt like somebody was putting this hot poker through my eye and into my jaw, and it never eased up at all. I tried to get the pain to lessen. I even banged my head against the wall and could not get it to lessen. I wish I knew what I could do for it. I wish somebody would tell me that I should stay away from alcohol and heavy smells, including the smell of cigarettes or pipe or a cigar, the smell of smoke, during the time that I'm in season, which is what we call for somebody who is in their cluster season. And I wish I knew what could be done for it. We know that 85% of the cluster headache sufferers are men. We know that a majority of cluster sufferers do or did smoke. We know that the average age where cluster begins, though it can begin earlier, is 28 to 30. And we know that there are some real idiosyncrasies with cluster. If somebody said to me, I get up at 2:03 in the morning, I bolt upright while lying in bed with a full-blown cluster.
Yep.
That would not surprise me.
Been there.
And if they then said that for the next 6 weeks, every morning at 2:03, I woke up with this thing, that would not surprise me. Yeah. So that's cluster headaches.
There's so many unique things about them. This is I've suffered from migraines in the past, and then I have had a bout of cluster headaches recently, on and off for years apart, like you said. And I don't have the olfactory stuff, but everything else you said is absolutely dead on. And it seems like there's so many specific, as you put them, idiosyncrasies. Like there's no mistaking that, like you just said, right around that time too. And you mentioned something with the migraines that was a big factor in my headaches, which was the circadian rhythms and a strict sleep and wake cycle. That was a big part of my recovery. But I know for some people, they get trapped in these seasons for years. It's really scary.
Yeah, it's very interesting. With clusters, we usually see an increased uptick around November and around May, June. That's why people try and think, oh, it must be allergy or something like that. We don't know what it is. We absolutely do not know what it is. We don't know why some people have episodic cluster where they only get it once or twice a year. And then they go into their cluster season for anywhere between 4 and 8 weeks. We don't know why some people then convert to chronic cluster headache. We don't know. We think I've done research to try and look between the relationship of the cluster and the hypothalamus gland in the body. I think that there's something there to that. I will continue my research, but we really don't know.
I will continue my search.
I am. My goal is to everybody to stay steeped on the cure for cluster headache. Then the fourth type of headache we want to discuss is called the secondary headache. In a secondary headache, you have something else causing the headache. I see it as a cervicogenic headache in most people, where their neck, their mid-back, their neck, the spine is causing spasms into the traps. The traps cause spasms into the back of the neck muscles, which clamp down on the blood vessels going up into the brain. Then when the spasm eases, you get this rush of blood into the brain. And so that would be a cervicogenic or secondary headache. You can have other secondary headache reasons. You can have a cerebral aneurysm. You can have meningitis. You can have dysfunction of your TMJ, your temporomandibular joint.
Sure.
And you can have a space-occupying lesion like a brain tumor. So secondary headaches are really important for your doctor to do a deep dive on and to figure out what's the cause of the secondary headache. There are other headaches with fancy names that we are not going to go over. Those headaches might be like a hypnic headache or a thunderclap headache.
Sure.
We're not going to discuss these variants.
Maybe in a future episode.
Maybe in a future episode when we talk about all sorts of extraneous medical things. We can do a deep dive in all those weird things. But what we will talk about is a common denominator between migraine, cluster, and secondary headache.
Sure.
But I need you to guess what that
I was just going to say, I'm trying to think. I'm biased, but maybe the microbiome or
wait a minute. Wait. Da, 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 da.
Well, I was going to say like blood flow, like you said before, because I know you're a cardiologist, and I know for the longest time that was kind of the school of thought. So blood pressure? I don't know. That's my guess. I'm not confident with it. I bet $0. I wagered $0, but I'm going, I guess I'm going blood flow. Okay.
So, I'm not a cardiologist. I'm just a bum who likes to study cardiology, but I'm not like Dr. Fisher, who's part of my healthy patient, our board,
I see.
our board certified cardiologist. But the answer to the question is caffeine.
Oh, duh. Yeah. Okay. Caffeine. See,
So here's why my neurology professor taught me that coffee is the number one cause of headache in the US.
Mm-hmm.
It's because of caffeine. Caffeine is a coin that on one side you have good effects and the other side you have bad effects. Coffee, if you were a cluster patient and you said to me, my cluster's just started, what should I do? I would tell you to go get a sugar-free Red Bull or two. And when you wake up at 2:03 in the morning, throw back that Red Bull. Because we know that in migraine patients and in cluster patients, and cluster and migraine are not the same animal, but we know in both of those, caffeine can help abate a headache. which is why all the migraine over-the-counter medicines like Excedrin and the ones mimicking it, and Withdrawal, which is, I think, a prescription, those medications have caffeine in it because we know that causing the blood vessels to change their dilation will affect what happens when you're getting a headache. But we also know that coffee withdrawal will lead to headache. So if you are a 4-cup a day, 5-cup a day drinker of caffeinated coffee, and then you decide, oh shoot, it's a Jewish holiday, Yom Kippur. I'm not Jewish, but I'll just fast in I'll fast in sympathy with them. And you fast and you get a caffeine withdrawal, you're going to get a headache most likely. So we know that the balance between too much and too little caffeine is what leads to headache in many, many people. So one of the things to do is you have to determine your caffeine limits. So if you have headaches, I need you to take a booklet and make yourself a diary. And I need you to start to track your caffeine intake and pair it with your headache frequency. So do you skip breakfast and just have caffeine? Do you get a headache after lunch? Do you have a soda during the day that's caffeinated? If you try having water instead, do you get a headache or do you not get a headache? If you have caffeine past 4 o'clock in the afternoon, does it keep you up? I need you to start writing down how much caffeine you're taking. Pretend you're on like Weight Watchers, but instead of keeping a calorie diet, I need you to start keeping a caffeine diary. And I need you to keep the headache diary. And we're going to look at whether or not there's a correlation between the amount of caffeine you take in, when you take it in, and whether or not you get headaches associated with it. In some people in which they have poor caffeine clearance, and you and I have talked about caffeine clearance before, the adrenal glands in the liver are important for caffeine clearance, clearing caffeine from the bloodstream, from taking it in. There is an online caffeine calculator. So Google online caffeine calculator, and you can find it, and you can use that to start looking at your caffeine intake. And what you want to do is you want to start withdrawing from caffeine to see its effects on your headache. So you don't do that cold turkey. Figure out your caffeine intake for the week or for a day, and then start by cutting it back 5% a day to 10% a day. Your goal is you want to cut back about 20% per week. So over the month period, you become caffeine free. Now, looking up what has caffeine in it will surprise you. Make yourself a list of all the things that you take that have caffeine. So caffeine's not just in coffee, it's in tea, it's in matcha tea, it's in chocolate, it's in certain medications have caffeine in it. So make yourself a list of what has caffeine in it that you intake. Use your caffeine calculator, cut back on your caffeine. When you're a month out from using caffeine, then you'll do 2 weeks of measuring your headaches. And then you need to find a good coach or doctor who knows something about headaches and caffeine that can advise you what you should be doing with regard to caffeine. Again, steady is the key. So if you're I take 2 cups per coffee, same time every single day, and I don't get much headaches, stay with that kind of routine. You don't really have to cut back on caffeine. But if you're wild, some days I'm really tired, I didn't sleep well, I have to drink even more caffeine. It seems like the next day I always have a headache. That's why the diary is really important.
Right, just to understand that. Is it about the disruption of the sleep? Is it about the blood flow? Huh? Like, is it a combination of things? This link in between caffeine and headache triggers?
Well, it's all of the above, because we know in migraine that when somebody's sleep pattern is altered, they are much more apt to get a migraine. And we know that in cluster headache, that when they enter deep sleep, REM sleep, is when, in my opinion, the hypothalamus secretes something that shouldn't be secreting and will actually trigger the cluster headache. And that has to, in my opinion, has to do with calcitonin, but I'm still doing my research. We'll see. But we know that there's relationships between sleep and headache. We also know that if you don't get a good night's sleep, the chance of having more tension in your neck and traps. If you don't have a good night's sleep, don't you think to yourself, boy, a massage would feel really good right now? Well, the chance is that spasm in your musculature is going to lead to a headache, either a migraine or a tension headache. So we know that there's a relation. We also know there's a relationship between caffeine and caffeine withdrawal and caffeine when you have a headache. So caffeine is a drug. The best delivery system for caffeine, in my opinion, is coffee, because it tastes good. But there are other ways to get caffeine in. And if you're just about getting a migraine or a cluster, then taking caffeine can help.
Yeah, I never did the Red Bull trick personally. I kind of wish I had now to see if it worked, but I was able to get relief from lifestyle changes. Luckily, I know some people aren't that lucky, but that's really interesting how it can abort a cluster headache, like right off the bat. I know that's kind of the difference when it comes to cluster sufferers, is getting them out of season and or getting them to abort an attack when it's happening to stop the suffering. So I don't know if you want to talk about that for a minute, the kind of what we know works, like the high flow oxygen and the triptans and that sort of thing.
Yeah, sure. So, there are different treatments for the different types of headache. I'll go first with the secondary headache. So if you have secondary headache, there are over-the-counter drugs like Advil or Excedrin that you can take that will help that. But you have to find the cause of the secondary headache. If it's a brain tumor, then I'm sorry to tell you, but massage to your neck isn't really going to help. But if it is muscle tension, then a massage or chiropractic care or physical therapy to the neck may be a lifesaver, a godsend for you. If you have migraine headache and it is not well controlled with watching diet, being very careful with your sleep. By the way, all headaches, there is one thing that helps all headaches. I know I've said this over and over and over again. Water, water, water. Right. Dehydration only hurts headaches. Poor quality liquids only hurts headaches. Water, water, good quality water. If you need to buy a water purifier, I can recommend a couple of really great ones. Water, water, good quality water, drinking lots of water is a godsend for all headaches. Drink water. If you have cluster headaches, there are some things that definitely can change your world. I think cluster headache is the most painful condition known to humankind. It is in my opinion, the equivalent of trying to pass a kidney stone through your eye. People that have
That is what it feels like.
people that have kidney stones will tell you that it's horrible. People that have clusters will tell you it's even worse than that. So cluster headaches, you want to get on high flow oxygen. We have just been through the ringer petitioning Medicare, and they have finally approved high flow oxygen for cluster patients. So that means the other insurance companies will follow suit.
Oh, good.
So high flow oxygen is a key to cluster. Triptans, which are a drug, if a person can take triptans, some people can't. Triptans raises blood pressure, and if a person has a heart anomaly, they may not be a candidate for triptans. If they're not, then there is another chemical that's an ergot called DHE that can help with clusters. It sort of went out of favor when triptans came in. It's coming back into favor a bit. I still don't think it's a great drug, but some people really feel that it is helpful. Some people will use a blood pressure medication, a calcium channel blocker for migraine headache and cluster headache. Verapamil is one that's used commonly with cluster. But you're going to do really well with cluster if you use high flow oxygen, and if you can use a triptan, if you avoid smells like tobacco and alcohol. I have seen patients use something called low dose allergy, LDA, low dose allergy. If you have cluster headaches and you would like more information on LDA, low dose allergy, you can look it up online. You can also reach out to me at doc@myhealthypatient.com, and I will give you the names of some practitioners that practice LDA, low dose allergy, for you to talk to.
Very interesting.
Low dose allergy is a godsend for certain people. And it's not the same as allergy testing and giving allergy shots. I'll leave it there.
Okay. Yeah, we can let the listeners do their own research. Speaking of letting the listeners do their own research, we just had Sanjeev Chopra back on the show, and he was kind of talking about the hottest areas in medicine right now, from the microbiome to CRISPR. And one of the things he talked about was psychedelics, and how there's all this crazy emerging research on psychedelics in, PTSD treatment and depression and anxiety. In my cluster research, I came across psilocybin. Now, I could never have you recommending people do drugs on my show, but has any of this research come across your desk? And do you think that there's maybe promise there if we were able to study it more?
Okay, so let me give you a caveat. I do not know anything about the relationship between psilocybin and migraine or tension headaches.
Sure.
So I don't know anything about that relationship, but I can tell you about the relationship between cluster. There is a group called Cluster Busters, and Cluster Busters' claim to fame is that the people in Cluster Busters know a lot about using psilocybin with cluster headache. All the research I've seen shows that, and I'm going to use a word to be very specific, microdosing.
Sure.
Microdosing of psilocybin for cluster headache will break a cycle. That is what the research shows. You can look on Cluster Busters, and they have research studies, and they're involved with university studies of cluster patients with psilocybin or the active ingredient. When I talk about microdosing, you do not need to trip
Right.
in order to get the benefits of breaking a cluster cycle, according to research. So I think there is a lot of promise with regard to psychedelics and many adaptive alterations that have occurred in the brain. PTSD, TBI, cluster headaches, all are brain problems that need brain resets. And there is evidence that shows microdosing of psychedelics can be of benefit. Do not do this on your own. Find a healthcare practitioner who knows something about it. Do not go to the street corner and buy a Tony the Tiger postage stamp with fentanyl laced in it.
You're so funny, Dr. Coffee. No, again, yeah, to be clear, this is not any sort of endorsement on the Coffee, Health, and Science podcast. It's something that's come up. It's something that's developing in the health field. And for people who are suffering with cluster headaches, you take a look at those research studies you mentioned, the efficacy is astonishing. I mean, like far exceeds most requirements for pharmaceutical efficacy. You know what I mean? So it's like just really fascinating. And again, this is in the category of do your own research and not a recommendation, but is definitely emerging science. It's pretty wild.
Yeah.
Whoa, we're deep in it. Should we wrap it up? I just realized we've been going. This was the end all be all to headaches. Is there anything you want to finish on that thought, Dr. Steve, or anywhere else you want to go before we wrap it up?
I just want to make sure that I was clear. Coffee has a relationship with all types of headaches. It's, in my opinion, due to the caffeine. Caffeine is the most popular and widely used food ingredient. 80% of the population uses caffeine. Caffeine does influence your health. Caffeine does influence cerebral blood flow. Caffeine does affect pain receptors in the body. So if you have headaches, it would be good to keep a headache diary. It would be good to use an app online to monitor how much caffeine you're getting and to do a correlation. I love headache management. I'm not going to play anybody's doctor, but anybody that wants to reach out to me and say, hey, I've got some issues going on. What do you think might be my next step of who could I talk to? I would be more than glad to help anybody. That's doc@myhealthypatient.com.
There you go, everybody. Dr. Coffee truly is the greatest of all time, as they say. Thank you, Dr. Coffee, for this extensive deep dive today and for all of your lovely work. We appreciate you, my friend.
No problem. Glad to do it.
All right, everybody. That's all for today. This is Jordan River and Dr. Coffee signing off, wishing you an extraordinary day out there. And we'll see you next time on the Coffee, Health, and Science podcast. Bye-bye, everyone.